Hello there. I hope you're all well. Today we will discuss the male reproductive system gross anatomy. Let's read today's question first. A 67-year-old man comes to the physician with symptoms of urinary urgency and difficulty initiating micturition. Recent testing confirms increased prostate state-specific antigen levels elevated at 12 nanogram per milliliter. A subsequent biopsy is done confirming prostate cancer. Given the progression of his cancer, the physician is concerned about lymphatic spread. Which of the following lymph nodes is most likely to first receive lymphatic drainage from the prostate? A. External iliac, B. Deep inguinal, C. Internal iliac, D. Lumbar, E. Superficial inguinal. Today we will discuss the male reproductive system gross anatomy. Let's try to find the answer as we study. Here is the gross anatomy of the male reproductive system. Note the various sequential parts. The ejaculatory pathway may be remembered by the mnemonic as shown. It begins with the seminiferous tubules, onto the epididymis, vas deferens, ejaculatory ducts, and onto the urethra. The arterial supply and venous drainage of the male viscera are a high yield topic. The testicular artery arises from the abdominal aorta. The testicular vein drains into the inferior vena cava on the right and into the left renal vein on the left. We will briefly go over the spermatic cord contents as they are clinically relevant. The spermatic cord is a cord-like structure which contains 3 arteries, 3 nerves, 3 fascias, and 3 other things. The arteries include testicular artery, deferential artery, and cremasteric artery. Nerves include the genital branch of the genitofemoral, cremasteric, and sympathetic nerve fibers. Fascias include external spermatic, cremasteric, and internal spermatic fascia. 3 other things include ductus deferens, tympaniform plexus, and lymphatic vessels. Tympaniform plexus of veins surrounds the testicular artery and is found within the spermatic cord, which extends from the abdomen to the scrotum. This can sometimes be varicosed, leading to a condition known as varicocele. This is usually left-sided because the left testicular vein enters the left renal vein at a 90-degree angle, making flow less laminar. Next, we have the prostate. The prostate is a small organ which produces seminal fluid and lies just below the bladder. It is supplied by the prostatic arteries from the inferior vesicle and the internal pudendal arteries, and the prostatic venous plexus drains into the internal pudendal vein and the internal iliac vein. The prostatic venous plexus can be involved in the metastatic spread of prostate cancer to the bones, especially the vertebra. Talking about metastatic spread, it is not limited to the venous drainage, but also lymphatic drainage. Here we look at the primary lymph nodes draining each of the reproductive structures listed. The testes and epididymis drain into the lumbar lymph nodes, also called the para-aortic lymph nodes, the seminal vesicle and the prostate into the internal iliac lymph nodes, scrotum into the superficial inguinal lymph nodes, and the external genitalia into the deep and superficial inguinal lymph nodes. Here you can see the nerve supply of the male viscera. Do give this a read as it may show up in context of an injury or while testing for reflexes. Note that the prostatic plexus is derived from the inferior hypogastric plexus and the supply of the scrotum is by the anterior and posterior scrotal nerves. Anterior scrotal nerve is derived from the ilioinguinal plus genitofemoral nerve and the posterior scrotal nerve is formed by the pudendal nerve and the posterior cutaneous nerve of the thigh. An important clinical finding is post-operative erectile dysfunction. Injury to the prostatic plexus or inferior hypogastric plexus and sacral splanchnic nerves within the prostatic fascia during surgery, particularly during procedures such as prostatectomy, can lead to damage to the cavernous nerves. This causes erectile dysfunction, altered ejaculation, and sexual dysfunction. Therefore, surgeons aim to preserve the prostatic shell to protect these nerves and maintain erectile function. Below you can see the reflex arc of the sexual response. You can remember it by the mnemonic PSS. Today's question is pretty straightforward and asks about cancer spread through the lymphatic system. A 67-year-old man presents with prostatic cancer. Which of the following lymph nodes is most likely to first receive lymphatic drainage from the prostate? The lymph nodes to first receive lymphatic drainage from the prostate are C. The internal iliac lymph nodes. Feel free to go over the answer explanation. Here is the key point. Thank you for listening. Don't forget to like the video and hit subscribe.